Okay, so I'm going to do a full physical assessment. The first thing I will do is check my patient's chart, look at the patient's history, check my orders, look at the patient's age, sex, race, their name, and then I will perform hand hygiene, go in, check for adequate lighting, privacy. All right. Patient's information in her chart matches her description based on her age, race, and sex. Hi, my name's Akila. I'll be your student nurse. Can you tell me your name?
Anaya Jackson,
And your birthday?
August 2nd, 2000.
Thank you. Do you know where we're at?
In the hospital,
And do you know the date?
January 26, 2021.
Thank you. So today I am going to be performing a full physical assessment. Okay. Can you tell me if you have any family history of heart issues, stroke, or high blood pressure?
No.
Have you ever had any loss of consciousness?
Mm-mm.
Okay, great. So I am going to be inspecting your skin on your body. I'm also going to be checking your hair. I'm going to be listening to your heart sounds, your breathing, and checking your strength, just to name a few things. Okay? All right, so we'll get started. I'm going to start from the top of your head and work my way down to your feet. All right, so I'm putting on my gloves. I'm going to check your hair first. So your hair looks nice and evenly distributed. It's nice and brown, looks healthy. I do not see any lice, any dandruff. I'm going to go ahead and palpate your scalp. Check for any tenderness, pain. You feel any right now? All right. Make sure you tell me if you feel any pain throughout the assessment, okay? All right. I feel no lumps, masses, and your head feels nice and evenly shaped, okay? All right. So next I want to take a look at your ears. So I'm going to check for drainage, and as I check your ears, I'm going to check the range of motion of your neck. So I'll have you rotate your head to your right. I do not see any drainage in your right ear. Rotate your head left. All right. I do not see any drainage in your left ear. So I will have you go ahead and flex your chin to your chest and extend your head up, nose to the ceiling. Great job. I will have you go ahead and lateral flex your ear to your right shoulder. Extend up. Lateral flex your left ear to your left shoulder. Extend up. Great job. All right, so the range of your motion of your neck looks great. So now I'm just going to palpate your ears, which means touch. You feel any tenderness?
No.
Great. All right, I'm going to take a look at your face. Face looks symmetrical. Your eyes are symmetrical. Nose midline. Lips look good. Nice and moisturized. No chapping. No blisters. Your skin looks nice and even. No acne, blisters, or abnormalities of any kind. All right, so I'm going to look in your nose. Check for drainage. See no drainage. I want you to hold one of your fingers on your right nostril and breathe through your left nostril. And I want you to do the same on the left side. Very good. Starting to sound clear. Now, I'm going to have you open up your mouth and stick out your tongue. All right, tongue looks nice and pink. Can you say ah?
Ah.
Your uvula went up as it should have. Go ahead and stick your tongue back in. Go ahead and push your right cheek out with your tongue. Left, and then your left cheek out with your tongue. All right, open up your mouth again. Okay. Your mucous membranes look good. Your gums look good. I do not see any bleeding, any inflammation. I do not smell any odd smells in there. And your cheeks look nice and white, healthy. Okay. The lining in your mouth looks nice and healthy as well. Your mucous membranes. Okay. So now I'm going to go ahead and check your eyes. Okay. So if you do not mind, I want to go ahead and take a look at your conjunctiva. All right, it looks nice and normal, and your sclera looks nice and healthy. Your eyelids are also symmetrical. I do not see any drooping. Can you raise your eyebrows for me? And can you frown? Can you smile? All right, so now I want to check the constriction of your pupils. I want to see how small, if they get small as I flash light into them. So I'm going to have you swing your legs over. I can be face to face with you. So I'm only going to hold my light about 10 to 12 inches from your eyes so I do not hurt you, okay? So I'm going to start with your left side. I'm going to put my hand in between to separate your eyes to avoid direct light getting into your opposing eye, the eye that I'm not flashing, okay? So, all right, I see constriction with your left eye and then consensual on your right eye. So it still gets small on your right side, even though I'm not flashing light directly into your eye, okay? I'm going to do the same. I'm going to go ahead and go into your right eye. Okay, I see positive for constriction and consensual on your left side. So now I'm going to do the cardinal gazes. I want you to go ahead and take a look at my pen light and follow the tip of it, okay? This is checking for your vision, your peripheral vision as well, and your eye movement, okay? And external eye movements also. So now I want you to follow the tip of my pen light to your nose. Checking for convergence. Very good. And back out about 10 inches. Now I want you to look at the tip of my pen light and then look at the statue. Tip of my pen light, look at the statue. Very good. And that's a combination. All right. So now I'm going to go ahead and go down to your neck. I want to look at your jugular vein first. I do not see any jugular vein distension. Your trachea is midline. I'm going to palpate your trachea. I want you to swallow. Okay, it's normal. Your trachea went up and down as it should have. Now I want to go ahead and palpate your carotid artery since I'm in the area. I will only do one at a time. If I check both sides, I might cut off your circulation. You could pass out, which we do not want. All right, very good. All right, so now let's go ahead and I'm going to assess your chest and listen to your heart sounds. Okay? So I'll have you lay down for me. Your shirt is off. You only have on a brassiere right now, so I'm looking at your skin. So I do not see any abnormal pulsations. Your skin looks good, looks normal. The color is even on your skin. No marks, no lesions, no swelling in any areas. I'm going to go ahead and palpate the precordium area. Okay, normal. And then I'll palpate the point of maximum impulse, or your apical pulse, which is in the midclavicular line. Fifth intercostal space. All right, good. So I'm going to go ahead now and listen to your heart sounds. Okay, so I'm going to listen to each area for 5 to 10 seconds, okay? So start right here. So in the second intercostal space, right sternal border. Listening to your aortic valve, 5 seconds. Then I'll go over to the left intercostal space, the second intercostal space, left sternal border, and I'm listening to your pulmonic valve, third intercostal space, left sternal border, listening to your Erb's point, fourth intercostal space, left sternal border, listening to your tricuspid valve. And then I'm going over to your fifth intercostal space, midclavicular line, listening to your mitral valve. And this is where I will assess your apical pulse as well if I needed to, just like I said before. Alright, so now I'm going to reverse, flip over by bell. Of course, I had to warm up my diaphragm first. Now I'm warming up my bell. I'm going to reverse, midclavicular line, fifth intercostal space, listening to your mitral valve. Then I'll go over to your fourth intercostal space, left sternal border, listening to your tricuspid. Third intercostal space, left sternal border, listening to your Erb's point. Second intercostal space, left sternal border, listening to your pulmonic valve. Second intercostal space, right sternal border, listening to your aortic valve. Now I'm going to listen to your carotid artery. I'm going to have you take a deep breath and hold it. Release. And now I'm going to do the opposite side. Take a deep breath, hold it. Release. I'm checking for breathing. There is no sound, so that is good. It means there's no sign of breathing. Okay? Now I'm going to go ahead and do respiratory assessment. I'm going to listen to your lungs. First, I'm going to check your chest again for respirations. I do not see you struggling to breathe. I do not see you using accessory organs to breathe or heaving. Your chest looks nice and contoured. It is not barrel chested or rounded. It is not pigeon winged. It's not pigeoned or winged. So looks good. I'm going to check to make sure. Feel your respiration. Make sure you're breathing. It's not strained. Okay, great. And also when I was checking your heart sounds, I was listening for any gallops or murmurs, okay? Or revving. So your heart sounds were great. So now when I listen to your respiratory sounds, I'm listening for wheezing, any stridor, any crackles too, just to name a few, okay?
Okay.
So I will go ahead and start with your right apex. I want you to breathe through your mouth. I'm going to listen for 2 breaths in each area, and then I'll move along, okay? I'll start with your right apex, so breathe out in and out of your mouth. Okay, that was 2 breaths, so that's the right apex. Now I'll go over to the left apex for 2 breaths, and down to the upper left lobe for 2 breaths, and the upper right lobe for 2 breaths, then the right middle lobe for 2 breaths, and the left upper lobe for 2 breaths, left lower lobe for 2 breaths, right lower lobe for 2 breaths, right lower lobe for 2 breaths, and left lower lobe for 2 breaths. Very good. All right, let's go ahead and sit up for me. I'm going to check your back, okay? So first, when your back is bare, so I'm looking at your skin, so your skin looks good. No cuts, lesions, bruises. Your spine looks midline. It's aligned as it should be. Your muscles look nice and symmetrical. I'm going to palpate for tenderness and pain. Any pain and tenderness? Any pain or tenderness? Okay, your paraspinous muscles are normal. They feel symmetrical. And then, okay, so now I'm going to listen to your heart sounds. Or I'm sorry, your respirations. I'll start with your left upper lobe, 2 breaths in and out of your mouth. And then I'll go over to your right upper lobe for 2 breaths. Right middle lobe for 2 breaths. Left upper lobe for 2 breaths. Left lower lobe for 2 breaths. Right lower lobe for 2 breaths. Right mid-axillary for 2 breaths. And left mid-axillary for 2 breaths. Okay. Good. All right. So since you're sitting up, I'm going to go ahead and check your range of motion. So we'll start with your shoulders. So I'll have you flex your right arm up above your head. Extend down. Left arm up above your head. Extend down. We'll have you abduct your right arm out. Abduct in. Abduct your left arm out. Abduct in. Very good. I'm going to check your wrist range of motion. So I'm going to have you flex your wrist up. Extend down. Flip over. Flex your wrist up. Extend down. Over. Abduct your wrist out. Abduct in. And I'm going to have you open up your hands. Abduct your fingers out. Abduct in. Very good. And close your hand. And I want you to go ahead and open your hand and touch your fingers on one hand to your thumb and the opposite side. Very good. Now I'm going to go ahead and examine your arms. You palpate. So your bones feel good. None of them feel out of place. Your muscles feel nice and symmetrical. You feel pain? And look at your hands. Skin between your hands look good. All right. I'm going to do capillary refill on your fingernails. There's no clubbing on your fingernails. They look nice and healthy. Normal capillary refill. Your fingers are rectangular and rounded at the tip. And I forgot to check behind your ears too. Make sure your ears are nice and normal too. Okay, so I want you to grab my finger and check for strength. All right, I want you to resist when I push down on your arms. When you hold your arms out, resist, and then go ahead and resist as a push up. Okay, so now I want to go ahead and, okay, so we did that. Okay, I'll have you go ahead and lay down so I can do your abdominal area. We're going to look at it first. Your stomach looks nice and flat. Skin is even. And your temperature has felt normal this whole time I've been touching you. Okay? So your stomach's flat. No excessive hair growth. No discoloration. Does not look bloated or distended. So now I'm going to listen first. Okay? Because I will not palpate first because I do not want to disrupt any of your bowel signs. Okay? So we'll start in the right lower area, right lower quadrant. following your large intestine, going around in a U shape. So right lower quadrant, I'll listen for 5 to 10 seconds. Right upper quadrant, listen for 5 to 10 seconds. Left upper quadrant, listen for 5 to 10 seconds. Left lower quadrant, listen for 5 to 10 seconds. All right, sounds good. So if I were not to hear any sounds in your abdominal area, I would have to check each quadrant for listen to each quadrant for 2 to 5 minutes each. But you do not have that problem, so that's good. Okay. All right, so I want to go ahead and assess your pulses. So I'm going to do, since your brachial pulse is right here, I'm going to check your brachial on your left arm, and I'll do a right bilateral, check your right brachial pulse. And then I'll do your radial pulse on your left arm and do bilateral on your right arm. I'm going to check your femoral pulse on your left side and then your right femoral pulse bilaterally. Okay, good. So I'm going to work my way down. I'll check your popliteal pulse, then your knee bone, and I'm doing your other leg. So that was your left popliteal. Now I'm checking the right. I'm checking them bilaterally. I'll check your pedal pulse on your left foot, and I'll check your pedal pulse on your right bilaterally. I'm checking your posterior tibial pulse on your left, and then I'll check the right posterior tibial pulse bilaterally. Very good. Okay, go ahead and straighten out your legs. I'm going to take a look at your skin on your legs. It looks normal. No edema, no swelling, no cuts, no lesions. I'm not seeing any ulcers anywhere either. All right, so I'm going to palpate. Feel any pain? Okay, bones feel in place, in line, your joints look symmetrical, your legs look symmetrical, shape, muscles feel, okay, feel nice and feel your muscles as well. Your skin is feels nice and normal, okay? So let's go ahead and check for your strength first. So I want you to raise your leg up and resist when I press down, and then resist when I push up. So your hamstring and quadriceps are nice and strong for your right leg, and I'm going to check for your left leg. So lift your leg up, resist as I push down, resist as I push up. Very good. All right, so I'm going to check your strength for your dorsiflexion. So I want you to resist as I push down, flex up, and resist as I push up. All right, now I want to go ahead and check the range of motion. Let me go ahead and check between your toes really quick. I did not see any abnormalities between your toes. All right, great. So let's check your range of motion. So for your right hip, I'm going to have you flex your right leg up, extend down, and left leg up, flex, extend down. I'm going to have you abduct your right leg out, adduct in, abduct your left leg out, adduct in. Check the range of motion for your knee. I'm going to have you bend your knee up, right knee up and down, left knee up and down. I'll have you rotate your right foot inwards and rotate outwards to your right. Rotate your right foot in and rotate out left. Okay. Your left foot in and your left foot out. Okay. So now I want you to do your dorsiflex, point your toes to your nose, relax, plantar flex your feet out. Relax. Okay. Okay, so next I want to go ahead and check for sensation. Okay. So, before we do that, I'll have you go ahead and curl your toes and then spread them apart. Okay. So I'm going to check sensation. So I have to close your eyes. All right. So I'm going to touch a certain area of your body, and I want you to tell me the area I'm touching and the side of your body I'm touching, your right or your left, okay?
Okay.
So.
Left ear, right hand, left knee, right ankle, left hand, right wrist.
Okay, so I did it 48 times, 24 times on each side. So you did great. All right, so now let's do your gait. So, I'm going to have you walk towards me normally and walk back. Okay, I'm going to have you walk on your toes and walk back. I'm going to have you walk on your heels and walk back. I'm going to have you walk heel to toe and walk back. Okay, now I'm going to perform the Bromberg test, where I'll have you put your feet together, hands to your side, close your eyes, and you'll stand there for 20 seconds to check for your balance. Okay, 20 seconds are up. All right, you gonna lay back down? You feel any pain or anything tonight?
No.
Okay, we're gonna check your vital signs, which is your blood pressure, your pulse, oxygen, your respirations, and you already said you have no pain, okay? And then I'll check your temperature as well. Your skin felt great the whole time. Your skin did not feel hot at all. I didn't see any abnormalities. I didn't hear any abnormal heart sounds, any gallops, any murmurs, any abnormal breath sounds, wheezes, crackles, stridor, which is a whale sound. So everything looks good. Your range of motion was great. You said you didn't feel any pain at all. No dizziness. You tolerated it well. And then your gait was normal. You have great balance. Okay? So I'm going to report my findings to your physician. And here's your call light. You can go ahead and give me a call if you need anything. Okay? All right. So I'm leaving the room, performing hand hygiene, and I will chart my findings.